Hey, welcome. This is Robert Browning. I'm one of the directors at HeartMath. I've been here for over 22 years. And just to give you a little touch of what this is about and what this is for you, and is that we understand how challenging it is to be a patient, to be on a healing journey, to be sick, to be trying to get well, the level of stress and anxiety and anger that can arise out of situations like that. It just can sometimes just not feel fair. And the amount of fear that can arise on, will we get well? How do we get well? And how do we manage our stress during that journey to optimize our chance to heal and to be more fulfilled and more connected with who we truly are during that whole situation. So HeartMath, it was born in 1991 as a nonprofit, a research engine that was basically doing research on how our attitudes, our emotions affected our health. And if we were stressed or anxious or fearful or angry, what we found out, and what others have found out, is that it makes our heart rhythm patterns very chaotic. Our nervous system gets a little frayed, and it doesn't help the healing process. But the more that we can help manage our stress and take control, take charge of our attitudes in the middle of just day-to-day life, day-to-day stressors, and we can begin to feel a little bit more or activate a little bit more of some sort of regenerative emotion, such as appreciation or care or courage or a passion for life. The more that those heart rhythm patterns become less frenzied but more coherent. And that harmony, that balance in the heart rhythm patterns is a very efficient, a very effective use of inner energy. And we need that energy to heal. We need that energy to be clear and to think clearly on how we take care of ourselves relative to all the information coming in. So learning a very simple two-step technique that you can use anytime, when you're laying in bed, when you're going to the restroom, when you're taking input from the physician or the nurse. If you can balance your heart rhythm patterns, you're going to think more clearly, you're going to be more collected, you're going to save a lot of energy, and it's going to help you heal faster. So let's do this little two-step technique. It's scientifically evidence-based research that supports the foundations of it. And you can do it while your eyes are open. No one has to even know that you're doing it. 2 steps. First step is heart-focused breathing. So literally, just drop your attention to the area around the heart. Imagine that your breath is flowing in and through your heart area, right there in the center of your chest. And you do it for about 5 seconds in and about 5 seconds out. If that's a little forced, a little strained, just find a rhythm that's comfortable for you. Just a little deeper than usual, though. So heart-focused breathing. Breathing in, breathing out, finding a rhythm that's comfortable. And when you feel that just set in just a little bit, now, step 2, make a sincere attempt to just re-experience a regenerative feeling. Anyone will do. Appreciation for someplace in nature, or for a pet, for maybe a dog or a cat that you just love to hang out with. Or maybe it's a child or someone that you care about. But anything that brings appreciation or care or any feelings of honor or dignity or courage, any renewing, regenerating emotion will help. So heart-focused breathing, and just breathe some sort of reference point of appreciation or care for someone or something in your life. And breathe that feeling through the heart area, as if it's happening right now. Once you do that, if you were hooked up to a Holter monitor or a little HRV, a little thing measuring your heart rhythm patterns, just breathing, activating and renewing emotion will automatically bring your physiology into a more harmonious state. That's going to help you heal. That's going to help you optimize inner efficiency and effectiveness so all your functionality is moving at a more optimized rate. It's just going to help you feel better. It's going to help you be more practically and meaningfully engaged with some more clarity on what to do next in your healing journey. So just promise yourself a few times a day, when no one, whenever is easy, do those 2 little steps. Or, and especially if you're stressed, if you're feeling a little anxiety, a little angry of like, why am I here? Or what happened? Or just impatient, go back to the heart, breathe through that area. No one has to know you're doing it. And just activate some sort of care of appreciation for anything in life. If that's helpful at all, check in with your clinician, your doctor, your nurse, someone on staff, and have them point you out towards more of these tools that you can learn, more of these techniques, more ways of how this science of the heart and regenerative emotions can help support you while you're here with us on this healing journey. Take care, and we'll talk soon.